Waiting for our KDAD staff. People like to get in early. Caitlin, see if you can unmute now. They have updated teams. Where's Seth and Mitzi?
I am able to.
Yeah, let me change your settings. I can't change it because he's not here yet. And then you should be able to unmute people too, Caitlin. I gave you presenter.
Okay.
All right, we're going to go ahead. I'm going to start admitting people. Good afternoon, everybody. We'll give about 1 more minute to let people get in. Beth Gilbert, are you here? For those that are just joining, I'm making sure everybody gets in, the majority of everybody, before we get started. Give about 30 more seconds to get in before we start talking. Caitlin, do you see Seth?
I do not. I know that he had a meeting that ran right up into this one, so hopefully he'll be on here in a minute.
Okay, I will go ahead and get started in respect of everybody's time. And then there are some items that thanks, Teresa, that Seth has, so I'll skip over those. And then Teresa and Caitlin, please let me know when Seth jumps on, and then we can come back up to his items. So everybody, thank you for joining us today. I appreciate it. This is the August 2023 HCBS Stakeholder Call meeting. So if that is what you are here for, you are in the right place. So thank you for joining us today. We appreciate it, to get updates on the overall HCBS team over here at KDADS. Thank you for that. And for those that may be new staff, or unfamiliar, or you forgot who I was, hopefully not, I am LaTanya Wright. My official title now is I am the KDADS HCBS Training Specialist, okay? And then I also have a couple more staff on here uh, that is available today. And then I will go in. So Caitlin, I will go ahead and let you introduce yourself, and I will get Seth.
So I'm Caitlin England, and I'm the Program Integrity and Compliance Manager. And Latanya, did you see that Seth needs unmuted?
Uh-huh.
Okay.
Yeah, can you get it? Or yeah.
I don't know. I'm going to be honest. I don't know how to do it. So
I can't not get it. I see. Sorry, everybody. I see everybody, and Mr. Seth had another meeting. So I have like 100 people. I have 107 people, and I'm looking for Mr. Seth to unmute him. As you know, we have to put mute on everybody because people get on and they forget they're not on mute. I found him. They're not on mute. And so we hear all that background noise. And I'm looking for Mitzi too, because Mitzi is supposed to get in here. So Steph, you should be able to unmute yourself and introduce yourself in case we have new staff on. And then I'm going to look for Mitzi, because Mitzi's going to go after you speak. So Seth, can you unmute yourself?
All right. Hello. Thanks everyone for your patience. We're a little out of practice, having canceled these the last couple of months. So I guess maybe we need to rethink that. Um, no, yeah. So just wanted to provide a few updates here. Appendix K is going to be ending. All of you should know that by now on November 11th of 2023. So we're currently still in the process getting ready to submit our waiver amendments to CMS, hopefully before the end of the month, to have those approvals in place before the expiration of those Appendix K provisions. So stay tuned on that, and be checking our website for those approved waiver amendments once CMS kind of gets through them. If there are any questions related to that, feel free to put it in the chat, and I can maybe go into a little bit more detail about where we are with those. As far as the HCBS cap, we started working with or starting receiving some technical assistance on. We've kind of got two corrective action plans. One is overall HCBS related. That we're getting some technical assistance on, but then we're also we've got a specific settings rule corrective action plan in relation to the heightened scrutiny visit that CMS completed in March, and we've put out the remediation strategies that the state is planning to undergo, and we do have quite a lot of work cut out for us yet in order to achieve full compliance by CMS standards. So we'll be looking to partner with a lot of you on some of those efforts as we kind of dive a little bit further into the work there that needs to be completed. So I think that's it for my updates at this time, unless anyone has questions that they want to pop in the chat. All right, Latanya, I will kick it back over to you.
Okay, and with that, Mitzi, are you on? Did you want to introduce yourself?
Okay, can you hear me?
Yes.
Okay, great. My name is Mitzi Tyree, and I am the Director of HCBS Initiatives here at KDADS. And Latanya asked me to join the meeting today to kind of give everyone an update on what we are doing with our FMAP initiatives for those ARPA funds. In case you are not aware of it, we do have a website for updates on FMAP. If you're not aware, we can be sure to include that in the chat here shortly. But just to kind of let everyone know where we're at and what we're doing. We're working on the targeted case management study with public consulting group. And there were several TCM meetings that were had a couple weeks back for TCM input. We also were awarded a contract to KCART to provide behavioral training to families with children with autism, and there's a flyer for that as well. I'm gonna write down things I got to include. Flyer and on Employment First, we are still waiting on getting a signed contract back from the contractor. We think there might be a little bit of delay on their end because a lot of times they want to change contract language. I hope that we have that sooner this week rather than later, because next Thursday we have a big Employment First stakeholders meeting. We would like to announce who the contractor is at that time so that we can get the ball rolling on what we need to do. Plus, our NEON hours for technical assistance expire at the end of this month. We also hired KU to do our DSW training, and work groups are already getting assembled for that. We are working on RFAs for remodeling grants for people to meet the final rule. And we'll have further discussions about that. That's still in its infancy. Mark Ditzler, who is with Employment First, he has made great contact with our school districts, and our hope is that we can begin to implement Charting the Life course and Employment First, starting with the school system during transitional age youth. Several of us are going to the HCBS conference next week in Baltimore, and we're really excited about that, and we're hoping to bring back a lot of info to everyone. Other than that, those are the only updates I have. We do have other projects that we are waiting for CMS approval on, that you probably have heard of, like smart home technology, technology first, and that kind of thing, but we are waiting to get word from CMS. Any questions?
Thank you, Mitzi.
You're welcome.
Okay, then please put your question in the chat, and those on the phone. When I open it up, please write down your questions. We're going to get through the agenda and then make sure we have time for questions on the end. Okay, so if you are on the phone, make sure you write down your question and get ready when we open up the lines to everybody. Again, everybody's on mute, so we don't hear all that background noise. Okay. And then I'll go back, since Seth alluded to it, about the meeting cancellations. I know there have been questions about that before I go into my different spills on the agenda, but canceling the meetings, okay? So I just wanted to share with everybody, these started off as the final rule. Monthly stakeholder call meetings. If you've been around, been working on a final rule, that's what these were used for. And we had a contractor that facilitated these meetings. As of January the 1st of this year, these meetings were brought back in-house. We were no longer using our contractor to facilitate them. And one thing we looked at as final rule was winding down for the state transition plan. Hopefully you know that as of March 18th of this year, the state transition plan had expired, okay? So in the beginning, that was all that original implementation of final rule to the state of Kansas, and we were giving out those regular monthly updates as we were implementing final rule, seeing what was going on, the compliance numbers and everything, and that's what we were having. But as that winded down, it's like, okay, all that initial hard work is done. After March 18th, March 17th, starting March 18th, we are going into the official ongoing monitoring and remediation for final rule. Okay, so it's like, okay, how can we expand this? Hey, there's a lot of things that reference final rule touches everything under HCBS, so we will start to do these general updates during this meeting too. Okay, so we have our agendas, and everybody, when the meetings are canceled, I do my best to get those meeting cancellations out there when we do not have an agenda. We don't want to waste anybody's time having a meeting, for 5 or 10 minutes. We want to make sure we're working behind the scenes. We're bringing you content to update you on things out there. So please, when these meetings get canceled, don't think you're missing anything. You're not missing anything because we don't have anything to share, okay? We want to give you back that time and give us more time up here to work on policies, initiatives, things, so we can bring you the information when needed, okay? Please don't feel that you're missing out on anything. If you have those questions, you can always email KDADS, email those program managers, email Latanya and Caitlin if it has to do with final rule or other entities that you may need to get information from, okay? But I just wanted to put that out there for that, okay? And then I'll go in under general updates, going back to the overall HCBS CAP, as Seth has said. Again, my official title is the HCBS Training Specialist. And hopefully you know that training and provider qualifications was one of the areas that the state is on a corrective action plan under the overall HCBS waivers, okay? So looking at that, I have been doing research and working on updating and enhancing training, okay? So that takes a lot of research, figuring out what's already out there, what are the gaps, what are their needs. I'm starting, at the home base up here, working with each waiver manager and other entities. And then I also will be coming out to talk to our MCOs, our CDDOs, our aging partners, our FMS providers, our TCM agencies, and service providers, okay? We got to figure out, how are you being trained? How are you training your staff? Is it approved by KDADS, your training for the services that you provide under your particular HCBS waiver? Okay, we got to get a handle on that. Is my understanding there used to be a very good training program up here at KDADS, and we want to make sure we bring that back and everybody's being consistently trained on what they need to do and being qualified and having some ongoing oversight and monitoring of HCBS training and service providers, okay? Want to make sure that's out there.
Latanya, there's a chat saying that your audio's cutting out and that it's happening fairly often. Just
It
kind of
must
a
be my
heads up.
internet connection. So hopefully everybody heard half of what I said.
You may want to repeat some of what you just said.
Can you hear me better? Somebody said it was fine for them. Thank
I'm
you.
hearing you fine.
I was gonna say, yeah, I think it's fine for some, so it looks like somebody else might be having some audio issues. It looks like the majority are okay.
Okay, so it's not me. So
It is
sorry, it
not
may be
you.
on your end. So training. So I'll get closer to my mic. Maybe that's it. But I was talking about training, and that's one of the areas of non-compliance for our overall HCBS. So that is something I'm doing research on, and we'll be following up with all our partners and contractors to look at what training is out there and then what training is needed. So please be thinking about training needs out there because we need to be all consistently trained for our particular, not mine, but your particular waiver and the services that you provide. And then the state of Kansas needs to make sure that we have somebody up here at the state level doing ongoing monitoring and oversight of those training and qualification. I know Morgan, y'all probably know Morgan does some of those QA checks, but there's some additional items that we need to make sure that are checked out there, okay? So that's what I was talking about. And so again, when I come knocking at the door, I'm asking about training. We're here to make it an overall better system, a better network, and that's why I'm asking questions about training, okay? If you already are ready to go, you see the gaps in your needs, of course, you have my email. I can put it in the chat if you're new and you don't know how to get in contact with me and say, hey, Latanya, here's some training that we do, or this is what we do, or here's some training we see that's out there that will be really good for the overall HCBS network, okay? And then, of course, KDADS will have some mandatory trainings that will be coming out for the service providers under the HCBS waivers, depending on which waiver it is. So again, be looking for that. We will keep you updated on training initiatives at the state level, and then, bringing that down to everybody in the different levels, all stakeholder levels. So we are looking for, our waiver participants, our families, our caregivers, again, our MCOs, our CDOs, our aging partners, our FMS providers, our TCM. We looking at training for everybody and anybody who provides a home and community-based service waiver, okay? Or the services that go along with that, okay? And with that, I just wanted to update on that, and I'm going to turn it back over to Seth to talk and give an update on HCBS waiver renewals and amendments.
Yeah, so we're currently in process for the IDD waiver renewal. Stakeholder meetings are taking effect. In fact, I just was on the stakeholder group for the unbundling the day services work group. So KDAD's, our intent is to try to have a waiver renewal written and submitted to CMS for review, since they take quite a bit of time at the end of 2023. So December of this year, we'd like to have something in place to be able to send off for CMS review. And the current waiver ends June 30th of 2023. So, that's our goal is to kind of have the rewritten IDD waiver in effect by July 1st of 24. The brain injury waiver is also on the same track. So if there are any questions related to either one of those waiver renewal activities, please send them my way. Um, And I already mentioned on the amendments, we do anticipate having those to CMS before the end of the month. Next week ideally. And they've assured us that they will be approving those prior to the end of the Appendix K provisions, so that the three areas that we are keeping, those being paid family caregivers, virtual delivery of services, and then the unbundling of assistive services those are the big three things, changes in the waiver amendments. So those should be in effect prior to the end of the Appendix K provisions. That is all I've got, Latanya.
For now. Stick around, Seth. Thanks, Seth. And Mitzi, before we move on to final rule, Mitzi, do you have anything, or any of your staff that I can unmute? Did you have anything else before
No,
we
we
move
do not
into
have
final
anything
rule?
else. I really
Okay,
appreciate it. Thank you.
yeah. Thank you. The next agenda topic is final rule, and as for those that work with final rule or have to do assessments, that is a huge project because it has a lot of sub topics in it. And so, okay, Seth, you are up. So I tell you, don't go far, come back. Did you want to talk about any particulars from the final rule corrective action plan and the status and the update on that? Because that is different from the overall HCBS corrective action plan.
Yeah, I've put out there, it's on the website of our remediation strategies that we submitted to CMS. So let me see if I can't pop that in the chat. So for those of you who maybe haven't had an opportunity to review that document, you can kind of see what it is we're indicating that we're going to do, with the overall HCBS system as it pertains to the settings rule. So I'll put that in the chat, or the link to their website where you can find that. And I would just ask that if you guys find the time to maybe take a look at that, so you kind of know where our heads where our head is at, related to that. We will be, we're looking at potentially bringing in, not potentially, we're actively pursuing bringing in a consultant to kind of help us manage some of these projects around both of our corrective action plans, and as it relates to policy and things like that. So
Thank you. And the next item under final rule is the compliance certification, presumed compliance certification, and recertification. So those are three different documents depending on what type of services you provide and what type of setting you have set out there, okay? I wanted to let everybody know, please pass it on, especially our CDDOs and our MCOs. And if hopefully we have some aging partners on here to pass that along about HCBS compliance, and that HCBS compliance portal is where all that fancy work happens out there, okay? Those are items that are out there that are needed, okay? These certifications, so again, compliance certification for the setting, that's what that is. Presumed compliance is for those that are like our home health agency type services. They get a presumed compliance certification. And then we have recertification that just went live a couple weeks ago, okay? And I'll go over that more in detail of that recertification and what that is as we go down the list here. But that is going to be needed. So any type of HCBS compliance certification from our HCBS compliance portal is going to be needed for upcoming MCO audits, and then the licensing, okay? When you get your licensing, depending on, again, your waiver, your service type, licensing is going to be checking for that HCBS compliance, either your presumed compliance certification, your setting compliance certification, or your recertification if your previous compliance has expired, and then you have renewed it for additional 365 days, okay? So that's what those are. So please, please, again, we have the final rule mailbox I can put out there. There's several of us that look into that, check that throughout the day. Or again, if you know LaTanya, email me anything concerning final rule and I will get you the answer or where you need to be, okay? So again, the compliance certification, presumed compliance certification, and recertification. That is for our providers that have to do final rule assessments, and you are going to need those documents, okay, going forward. Please, please make sure you know what those are or you know how to get those, okay? And then the HCBS compliance portal, okay? I want to clarify because I talk to people almost daily. They get us confused with KMAP, okay? The HCBS compliance portal is the electric database used by the HCBS compliance team up here at KDATS. It is where the service providers and the final rule compliance team do those assessments and work with the provider to come in compliance with the final rule, okay? It is not KMAP. We are intertwined with KMAP because providers, the new providers, have to come over to us, the HCBS compliance team, depending again on the waiver and the service type, because they have to make contact with us. That's one of our ongoing monitoring checkpoints to ensure that we are capturing all providers that need to be assessed for final rule. So when providers go to enroll in KMAP, either their initial enrollment or their re-enrollment, KMAP is not going to let any provider initially enroll or re-enroll in KMAP without that compliance letter, which comes from the HCBS compliance portal. It's the verification HCBS compliance portal letter. That's what it is, okay? Again, reach out to the final rule email, or you can reach out to me directly, and I will get those providers where they need to be. Okay, that's what that is. And what that is, they can get that letter to show that they've made contact with us. We have their information so we can follow up with them. We allow them to roll in KMAP, but letting them know you have to come back to the HCBS compliance team to start your assessments for final rule. Okay, we will work with you, give you time, especially our new providers. I know it's a lot of stuff that's out there, and I'm watching the chat and I will come back and answer those. Okay. And then making sure those providers, especially our new providers, are able to continue on with their KMAP enrollment. Again, we don't want to hold anybody up, okay? But if you haven't made contact with us, you're not going to get that HCBS compliance portal. The team will not download that. LaTanya is definitely not downloading that because you have to set up your account. Those providers have to set up their account, okay? So we know what's out there. We can follow them and track them and follow up with them if they don't come back and do their HCBS assessments that are needed, okay? And again, I'll talk about it later. If you're non-compliant, what does that mean in the state of Kansas, okay? Assessment and remediation. I'll cover that before turning it back over. We continue again, remember, as I talked about earlier, after March 17th, officially March 18th, we are in our ongoing monitoring and remediation phase, okay? So CMS has let us know, okay, this is your state transition plan. You told us how you were going to get final rule compliant. And now, hey, it's after March 17th. For all your providers that are out there, you got to continue ongoing monitoring. Again, that's our checkpoint with KMAP for new providers out there. Hey, when they come in, how are you going to make sure they make contact with the final rule team and start those assessments? So we will continue. We have our HCBS compliance team continue to process new assessments, new providers. Again, a lot of you are doing an excellent job when you get those new settings or those settings move. You're getting into that HCBS compliance portal. You're letting us know what's going on, and we will continue to work with you. Again, as long as you as a provider, you engage with the HCBS compliance team or me to let me know what's going on, then we will work with you on remediation, okay? Providers are given 30 days to meet final rule compliance. We understand you got things going on and to give you time to get your policies and your procedures, okay? So again, share that with everybody, okay? Because I know a lot of providers get concerned if it comes up, they're non-compliant, okay? I'm LaTanya. I tell you, I'm not scared to tell you. I'm behind the scenes. I'm the one that triggers the button for non-compliance, okay? I get financial documents. I overlook that. If you're not in that HCBS portal, you're not engaging. I can see what's going on in that portal behind the scenes. As long as you're engaging, you're working towards to complete your assessment, or your assessments has done a desk review, it's returned to you. We can see you. We can see when you're getting into that portal, you're engaging or you're emailing us knowing what's going on. We're going to work with you, okay? The concern is when a provider is not engaging, okay? They're not engaging. We will do outreach. I will call, I will email, or some of our KDAD staff will call and email, hey, what's going on? What can we help you with, okay? We're friendly. We're not here to close you down. We're here to work with you to meet compliance. I always say that, and you know the team is always there for you, okay? Hey, when you don't engage or that provider isn't engaging, then that's when we trigger off the non-compliant for final rule to the MCO. We work with them. If that doesn't work, then the transition proceedings start, and then that's what's triggering the recoupment of funds. So far, we haven't had anybody get to that point, and we don't want anybody to get to that point. Usually when I turn it over to the MCO and the MCO gets involved, they do their outreach, we figure out what's going on, providers get over to us where they need to be, and we start that engagement back and forth. We got it from there, okay? So we don't want anybody to go into transition proceedings, because again, this is about the waiver participants. And hey, we don't want to disrupt those services. We're all here to provide those services to the waiver participants, okay? And then we don't, of course, nobody wants to go back and pull back those HCBS funds, okay? Because remember, after March 17th, if a setting is non-compliant, they shouldn't be getting HCBS funds. But we talk to CMS and say, hey, let us can we get approval to give people 30 days? Because it was brought back to us, hey, people move, what happens? Okay, you get 30 days, get that new setting in there immediately and start that engagement with us so we know what's going on, okay? And there won't be a disruption of services, okay? So I really wanted to stress that and put that out there. Again, our partners out there, really stress that to your affiliates and the agencies that you work with, okay? That there is a 30-day grace period to meet final rule compliance. And if you're not compliant, then that's when we trigger off non-compliance and contacting the MCO and figuring that things out, okay? But we don't want to do that. We don't want to do that, okay? And I want to put out there, and I said it, you can take this to the bank, go get us a lotto ticket, share some of the winnings with LaTanya. Okay, as we talked about, we are on a corrective action plan overall for non-compliance in a lot of different areas, okay? So we're working on that. We don't want to scare anybody because we get the questions of what's going on, how is this, am I compliant or am I not compliant? Okay, you're compliant at the state standard, but CMS came in and did their March visit. So technically, after their visit, nobody's really compliant, but we are not going to go back and redo anything, okay? I want to put that out there because we're getting those questions to providers from their old settings and their new settings, okay? So I want to put that out there. We are not going to make anybody go back and remediate those previous assessments, especially, as you know, there were a contractor and KDAS didn't bring this in-house until last September the 1st. So we are looking at what's going on. If your new assessment comes in, then that's why we're getting the questions, well, hey, this passed last time, but why aren't you letting it pass this time, KDAS? That's because after CMS's visit, more education and training to the state staff, we're like, okay, we're not going to go back and make them redo all their previous assessment. We'll catch it during their new assessments and during desk review and ongoing monitoring, okay? That's where we will work with you to make sure you update things according to CMS's visit. And I know Caitlin has some more information that she will talk about on that, but I just want to put that under remediation and why during desk review, maybe something was found compliant, you resubmitted that same policy, and we're saying, no, we need to remediate this, we need to add this or take away from that, okay? But that's what's going on with that under my remediation section, okay? And with that, Caitlin, I'm going to turn it over to you to talk about heightened scrutiny. And everybody, please be prepared with questions, and we will get those answered as we wrap up here. Thank you.
Thank you, LaTanya. So for heightened scrutiny, a couple of updates here. Just wanted to let everybody know that we are still waiting to hear back from CMS on those final determinations. So if you do have a setting that is, pending final determination, continue, your business as usual. I did want to let you guys know that we won't see much movement on this, these determinations until CMS approves the cap and the remediation for the heightened scrutiny settings that Kansas has presented with them. We do not have a timeline for, a response. If you have a setting that has completed that screening 1, so the desk review and the screening 2, the heightened scrutiny process, and your summary packet has been submitted, I just wanted to let everybody know that we will be sending out an attestation to have you guys complete. This attestation will be sent to the identified contact person for that setting that is within that HCBS portal through email. The expectation is that the attestation would be reviewed, completed, and signed off on, and then returned to KDADS to be kept on file for that setting. These will come for each setting that still has that heightened scrutiny designation. So if there is one provider contact, they may receive numerous emails. The attestations will clearly identify which setting it is pertaining to. All heightened scrutiny settings, like I stated, you guys can continue business per usual with that attestation on file. So once you get the attestation, get it signed, completed. If you have any questions, feel free to reach out. We will, be putting those in the portal for safekeeping, so we have them. And also just letting you guys know that you guys should ensure to keep a copy of your completed attestation. This is the document that each setting uses for verification to the MCO and state licensing of the setting's approval to continue serving HCBS or billing HCBS services while under a pending full compliance status. We do intend for these attestations to start going out on the 1st of September. I primarily will be the one sending them out. If you have any questions when those come out, please just, respond to that email and I can answer them accordingly. Other than that, that's really the only updates I have for heightened scrutiny. If you have new settings, get them in there and we'll continue to work with getting these screenings done and as timely as possible and get you guys through that process. With that, I will turn it back over to Seth for the ongoing monitoring policy.
Yeah, we're very, very close to getting this policy out for public comment, and we will be sure to send a notice out when that does happen. Our goal, or at least my goal, would be to have it, finalized by the time this group or this stakeholder call is held again. That way we kind of walk through it a little bit more in depth, just because looking at it now, it'll be quite lengthy, just with, as you all are aware, that coming into compliance and all the various different setups that providers have, it can be quite cumbersome. There's no one size fits all. So we had to make sure that this policy covered all the various scenarios that we might come into when it comes to determining whether a setting is compliant with the rule. So that all that to say is that policy is very close to being done. We also are working on some companion documents, to create some visuals for how the process should go, and maybe make it a little bit easier for people to fully visualize how to achieve compliance, because our goal is really not to shut down any providers or strain an already strained capacity shortage system. But we are needing to bring as many providers as we can into full compliance with the CMS settings rule expectation. So that is where we are there.
So in a nutshell, ongoing monitoring is coming. It's coming, everybody. We have to do it. We just got to get our ducks in a row up here before we come to you. Okay. And then under another subtopic under ongoing monitoring is, again, as I talked about earlier, the annual setting recertification, okay, or the provider service, depending on if you got that presumed certification, compliance certification from us, okay? And the provider attestation. That is one thing. Again, it all happens in that fancy HCBS compliance portal. It's getting fancier and fancier every month as our IT people work on it. But okay, again, the setting recertification. I get this. Some of you providers are on it. You're going into your account under, and you see all these red expired. What's going on? I had compliance last week. It's saying my compliance has expired again. It is a requirement of CMS. Again, they're saying, hey, KDAS, how are you going to continue to do ongoing monitoring and oversight to make sure these providers continue final rule remediation and compliance, okay? And one of the things we had told them, we were going to build this database system, okay? The HCBS compliance portal as a way to do that checkpoint on top of KMAP and other, checkpoints under ongoing monitoring, okay? So everybody, please, please, please know and understand, okay? CDDOs, especially our IDD providers, please, please share this, and our aging partners, please share it with our assisted livings and our home pluses and all of our settings out there. Settings compliance expires every 365 days, okay? I'll say it again, the setting compliance expires every 365 days, okay? So after that initial assessment, which is a lot of work, it's a huge assessment because we have to assess all these different trigger points to make sure we're going back to the final rule regulations and figuring out how that provider is implementing final rule policies and procedures, okay? So once that first initial assessment becomes compliant, again, it will expire every 365 days in the HCBS compliance portal. That recertification process just went live 2 weeks ago, which is why those that are on it, maybe you're adding a new setting, you're going in there to update something or delete a setting, add a setting, you're seeing all these expired settings in there. That's what it is going on. It was just implemented last time, okay? So there's two things going on. If a settings location is about to expire, there's a 60-day window right there, okay? It hasn't expired yet, but it's going to expire. The system is built to automatically send out emails to that provider. So hopefully all of your provider contact information is going to go, that email is going to go to that main provider contact. So please, again, reach out to me. We can get that updated. That main person that's listed on your HCBS compliance portal account is going to get that email, and then the reviewer that's assigned to your account, and it also goes to the KDAD staff. I'm one of those that's behind the scenes, KDAD's admin for final rule, okay? It goes to us and lets us know most of you have been doing great, getting in there, doing that recertification process. When that email comes out, it has the guidance on how to recertify in the system, okay? That's automatic. If you've already done everything, nothing's changed at that setting, you're making sure everything's good in there, you have to attest to that, okay? We all know, in America, you sign your signature away, you attest. To the best of my knowledge, everything I said is true, and you attest to that, okay? So hopefully you're doing that. We're going off an honor system, okay, to say that. It'll get caught later on, okay, doing ongoing monitoring or those financial records that LaTanya gets, and we'll deal with that if you're attesting to something, and hopefully you're doing it. We all got good faith in everybody, right? That you're attesting to the best of your knowledge, everything is good on there. That's what that is. If nothing has changed, the system is going to automatically give you a 365-day extension on that compliance setting. Okay, it's going to say it's compliant again, according to the state standard. Okay, that's what you're going to get. If something has changed, then that's where it's going to trigger to me, and I go in there and look, I talk with you. A lot of it's been staff has changed. So all I do is go in there, I talk to that person who's working on that. We make sure that staffing gets updated, clean out old staff that's no longer there that you don't want associated. That's what that is for. Again, that checkpoint. Let's clean up your account and make sure it's updated. Okay. If something has changed at the setting, maybe the services has changed, you've added services, you've discontinued services, the service location is, I'm starting to get, they're no longer group homes, you want to change them into shared living type settings, that's where it's going to be a little bit more work. We got to figure out what's going on. Do we need to bring in licensing to get you licensed for anything? That's where you may have to do another full assessment or a partial assessment, okay? Again, it's by case by case basis. We'll figure out what's going on and get you to where you need to do to make sure you can continue to provide those services, okay? So that's what that setting recertification is, okay? Again, once your original certification for your setting expires, again, the MCOs and the licensing are going to be looking for an updated setting compliance or presumed compliance certification, okay? That's what they're looking for. They're going to be looking at those dates. We look at those dates too. So if you got your certification, you printed it off, it's expired, you need to go back into the portal and make sure you're getting in there and you're doing those recertifications for your settings out there. Because if it's expired, when the MCOs and our licensing, KDAS licensing looks at it, it's not going to do you any good. But that recertification process is live and available in the HCBS compliance portal, okay? And I want to make sure that's out there. But for our providers, some of you are getting in there and your stuff expired before the process was available, the recertification process. So the emails didn't go out to you because it's past that date, okay? That 60-day window. That's why when you get in there, because some of our providers, you have a lot of settings. And so you get in there and your whole dashboard is red. It's letting you know, hey, everything is expired in here. All you got to do, and again, you can email me. I see Caitlin put my email in the chat. Thank you, Caitlin. But you'll see on your setting, go over to the right column, you'll see recertification process. Click on that. Again, the system will walk you through what you need to do. Again, if you need help before you start anything, reach out to me. And I will walk you through what needs to be done with that. But that is what that is. Again, that's an ongoing monitoring checkpoint. It is setting recertification and attestation process, okay? So please, please, please pass that on. So providers, hope you're all on here, or our CDDOs and our aging partners, please pass that on to your affiliates and let them know that is in there, and that's how they can get it to be prepared for those MCO audits and that licensing checkpoint, okay? And with that, Caitlin, I'm going to turn it back over to you to talk about on-site visits under that, and then the on-site expectations.
Thank you. So moving forward in the ongoing monitoring process, each setting could, potentially have an on-site visit every 2 years or as needed. So if there, is a report that comes in, or maybe we just have, time to get ahead of things, we could potentially schedule a visit within, a 2-year frame from the last one. But just wanted to kind of give you guys some insight on what these visits would look like. Your KDAS reviewer will be the one that conducts that visit, and they would be there to review your setting for your continued compliance with the settings final rule. During the on-site visit, you can expect the state to observe the settings culture of care, interact with individuals served and support staff, as well as review documentation specific to that setting to include current policies and procedures and participant service plans, PCSPs, behavior support plans, or any other necessary data or documents for their review. The on-site visit for our providers to prepare for that. We would like for you to provide a hard copy of your current policy and procedures, and we are going to ask that this is a clean version. I know that there's been a lot of editing of policy and procedures going on, trying, coming into compliance or, getting that verification. So we are going to ask for a clean copy that we would be able to bring back with us. They also will be asking, for the setting to have access to the individual's files for review upon request. It may or may not be requested. It really just depends on who the reviewer is and the things that they observe throughout the culture of your setting. And also just kind of a reminder or a side note here to ensure that the setting, that you guys work with the state to schedule that visit for a time, that your participants would be at the setting. Don't have them come when they're on an outing, or, if they are, doing a bingo game or something, where they are busy, because we will be walking around, kind of touring and just interacting with people. And just for this, for the, informational for the individual served or the participants, we would ask that you would at least, notify them, that the setting would notify them that we were coming for a visit, just because potentially they could, we could, run in and, ask them some questions. We could, ask to see like their personal space if they didn't mind, things like that. So just, giving them that heads up, just so that they're not caught off guard by anything. that's really all that we have to share in regards to that on-site and kind of what to expect at this time. So I will turn it back over to LaTanya to discuss training.
How come I do all the talking? It's like
You're
I
so
got
good
more
at
of the
it.
agendas, Seth and Caitlin. Okay. Hey, I see from Brianna, if I pronounced that correctly. Is this required for home care agencies? I'm thinking you're talking about the recertification uh, with that. And so I will respond. If not, please, Brianna, put it in the chat. No, Latanya, you're off in the woods. This is what I was talking about. But recertification, yes, is for the home care agencies, which, as you all know, that's that 5125. So I'm glad, and I love seeing our home health agencies on here, or our agencies that do that home health care type services. A lot of our hospitals out there in our rural areas. So thank you for providing that services. And that is that 5125 billing code. Okay, so I'm glad you brought that up, Brianna, because that 5125 billing code is very tricky. Okay, and so that is for some of our providers that do that 5125. That is those personal care services out there, and you know that can happen under a lot of different waivers. So it depends on the waiver and the setting, okay, to get that presumed compliance. That's why we have a presumed compliance workflow. Me and Caitlin are the ones that process that. And when it comes in there, we're looking at that. We see what type of agency you are. It's for some agencies, they have to take the full assessment, and what it triggers that if you have a facility, because you know personal care services can be provided in a facility. If you have a facility where your waiver services are provided, you must take the full final role assessment, okay? But if you provide those personal care services in that individual's private home out in the integrated community, that means the provider does not own or control that setting. That's where it gets tricky too, because I ran into some assisted livings that have like those campuses and they have apartments, and it gets tricky. And they're like, well, Tanya, that's their own apartment that they rent from us. And I explained to them, yes, but you own it. They're renting from you. So you fall under that provider owned or control, and you have to take that full assessment for all those apartments out there that those individuals getting home and community-based services are in, okay? So again, it's a case-by-case basis. Reach out to me. I help explain it. We walk through that again, that setting. There are so many different types of settings sitting out there, and we will get that figured out for you, okay? But if that person is truly in their own private home in the integrated community, meaning anybody can live there, their own home that they own, or with that family member, then that is, according to CMS, considered, you know, integrated. And if that provider, that home health agency is only going in there to provide those, you know, approved services, they have no control. They're not telling anybody what to do. Hey, we're just in here for these hours. We're approved a week. We provide these personal care services and we're out of there. Okay. We're not trying to run anything, do anything. Hopefully you're connecting them to services or whatever, or calling somebody if you do see something, but you have don't control the lease, anything like that, any other controls of that other thing going in to provide those personal care services. Okay, so that's what that 5125 is, and how the setting type totally depends on if you have to take a full final rule assessment or can you get a presumed compliant. Okay, and there's also some medical codes in there, like if you only do like, what is it, the medication reminder or the home buddy, and that is the only service you do, then yes, there are some other billing codes where you can get presumed compliant. Okay, again, making sure you come to us, you reach out, you make contact with the HCBS compliance team, and then we will get you where you need to go to make sure you're either compliant with the final rule or you get your presumed compliance certification. Because again, you're going to have to show that to the MCO and licensing when they do their checks. Okay, so I wanted to go back to that. So Brianna, I hope that answered your question with that. Okay. And then training, and then we'll wrap up and open up for questions. Training, final rule training, because again, we're on 2 different corrective action plans. So again, if you looked at that final rule site visit back in March, training was another thing that popped up under final rule, okay? And what it is and what CMS's concern was is that KDAS needs to make sure that providers clearly understand the expectations of final rule implementation. That's where the disconnect was, okay? Because we do desk reviews, we look at your policies and your procedures, and you tell us, hey, yes, we're going to do this, or yes, this happens at our setting. A good example is individuals served by ABC Network have access to food whenever they want to. They can have visitors whenever they want to or whenever they choose. They can go out into the community and do whatever they want. But when we look at, like when CMS was here, when we look at the practice of that policy and that procedure, that's where the disconnect is. So they came back and said, hey, KDADs, you need to do some more training for your providers to make sure they clearly understand what final rule is and how to implement that at their setting, HCBS settings out there. Okay, that's what that is. So again, I'm in research mode. We're looking at it. As Seth talked about, we're looking at bringing in experts to help us out, learning, getting TA from CMS and saying, okay, what are you looking for before we start all this work to make sure we're on the right path, to make sure, again, overall compliance with final rule and the other areas of concern. You know, again, those person-centered support plans, the options counseling were some problem areas under both of our corrective action plans that we want to work on again. And again, we want to make sure we got training at all levels. So again, for our waiver participants, our families, our MCOs, TCMs, aging partners, CDDOs, state staff, everybody. Okay, so you're all included. We want to make sure our service providers, everybody has some type of state approved, consistent training that's out there. So that's something, it's not going to happen overnight, but let you know it is coming. And again, put it out there. When I start poking around asking about training, again, we're not here to, you're nothing in wrong. We just want to make sure we do the best that we can to enhance what we already have or create new trainings out there that may be needed. Okay. And with that, that is our agenda. We've gotten through it. So we will check the chat. I unmuted everybody. So if you have a question, if you're on the phone, or if you're on the Teams meeting, you can unmute yourself, say who you are, and if you have a question. And then Caitlin, do we have anything else in the chat that I may have missed that might have been a question to follow back up on?
There was a question back towards the beginning asking if the training you mentioned was just the settings final rule.
There will be 2 sets of training. Again, we're going to have HCBS trainings, and those come back into the waivers. So again, like it's really a bunch about provider qualifications and training. So if you are an HCBS waiver service provider, whatever it is, whatever service, and I tell you, go back, what service do you provide under your particular HCBS waiver? Go back and look for those training requirements and those qualifications in that waiver. If it's IDD, PD, FE, whatever you do, make sure that your staff is trained and is qualified to provide those services. That's what our corrective action plan, one of our deficiencies for the state of Kansas is, okay? I'm doing the research, I'm looking at that, I'm meeting with all those program managers, okay? We're looking at that. I see I need to go over to the state plan stuff, because some of our stuff is intertwined with the state plan stuff, like the TCMs. I hope some of you are on here. You usually come. Our TCM stuff, we already know we're working on that. We have a TCM initiative, but training is a big thing that's under TCM. That's a state service plan, but it's intertwined with our waivers, you know, our targeted case managers. So looking at, hey, as overall service providers of waiver services or things that tie into our HCBS waiver services, what are your qualifications? Making sure we're checking, we're doing oversight of that. And also, how are you getting trained? Are you meeting those training requirements? And if you don't see training requirements in the waiver, be on alert. There will be some, okay? Like I said, overall, like we're going to have an HCBS. We don't have to have it, but we're going to have it. HCBS 101, final rule 101, you know, A&E 101. Those are some things that are going to be requirements that are coming. Again, we're getting back behind the scenes. We're getting policies and procedures in place before we come back out. And again, we will let you all know you're going to have time to get into compliance. You're not going to be blindsided. We all know, but those will be some basic trainings that everybody is going to have to take. Okay, those are some of the things we're responding to CMS that yes, we do have training. We will have training for overall HCBS. Okay, when it comes to final rule, that's a different set. you know, a whole nother monster, as they say. We got to do that final rule specific type training. So a lot of that I'm seeing is going to have to occur on site, because as Caitlin said, we have to come out there because we do the desk review. That's what we did during COVID, right? We saw your policies and procedures. We're like, okay, on paper, you're compliant with final rule, but we weren't able to get out there on the site to see how your staff implements your policies and your procedures. So if you look at our final rule report, you see where like privacy, they pulled out privacy. Privacy is something under final rule that must be given to waiver participants. So it's like, yeah, staff gives privacy. Okay, tell us how you give privacy. One of those, a lot of providers were saying, well, we knock on doors and announce ourselves. Well, we saw out there, and I went out there, I went to 2 settings out there, staff wasn't doing that. So those are the type of things where that gap is. Okay, you say you knock on your door and you announce and you wait, or again, if somebody doesn't respond, you're knocking, you're announcing yourself, you're peeking in, again, making sure they're okay, because maybe they've fallen down. That's okay, but we're making sure we're having that respect. Maybe somebody's getting in the shower, they're getting undressed. So that's why we got to step back and do that. Hey, it's me, can I come in? Or of course, once you peek around the door, if they're not responding, you know, emergency situation, there's a crisis, to get on in there. And hey, I'm totally against throwing final rule out the door, because you got to provide those emergency services, okay? Or call 911. But those are the type of things. So just thinking about that. Visitation. So again, as Caitlin talked about, we're looking at that, saying on paper that, hey, people can have visitors whenever they want. But then we get out there and it's like, well, they can't have visitors from 10 p.m. to 7 p.m. In a home and community-based setting. CMS is saying, hey, that's non-compliant. If there's somebody wants somebody to come spend a night, or they want their family member or friend to stay into 2 or 3 o'clock in the morning, those are the type of things. And like, again, we're getting our experts to come in, help us, what's going on in other states, learning from other states. How did you get compliant? How did you remediate with your corrective action plan? Hey, will that work for Kansas? So that's like the difference in the overall HCBS corrective action plan versus the final rule corrective action plan. So I hope that answered that question. So it is intertwined, but it's different. Okay, anything else, or anybody want to unmute and ask a question?
See, it looks like oh, go ahead.
This is Tammy Hammond at Rosewood. And if we could back up to the personal services with agency directed, we're still a little confused on that. We have a handful of folks that we pay the parent or sibling to care for them in their own home. It's basically they direct it. How do we treat that?
That is, thank you for asking that question, Tammy, because that's where I was saying that 5125 gets so tricky. And I do have 4 of you. You are also IDD providers. So hopefully those other 3 IDD providers are on here. You've done all you can do, Tammy, right now. It's in the HCBS compliance portal in queue, because when we developed that process, we were thinking about the home health agencies, okay, and the assisted livings to screen them in or out of taking that overall final rule. So you continue those services as you do now, but we're looking at, and what the concern is, Tammy, and those other 3 providers that we have that do IDD, and then you're also doing this 5125 too, which can get tricky, again, depending on which waiver you're under, which is the, we can't give you a blanket presumed compliance. Okay, because we're saying, hey, these providers can either own or control some of these settings. And I've asked that question, like, could, and the response was, yeah, we possibly could, LaTanya. And that's where we had to put on the brakes. It's like, well, we can't give them an overall presumed compliant blanket statement, because they may have settings that are owned or controlled by the provider. And again, if you as a provider, you own or you control means you manage that setting, because we have a lot of our IDD providers who they have entire apartment complexes, we found out under final rule. You don't own that apartment complex, but whoever owns it has given you total control, and it only serves individuals with intellectual developmental disability. That is fine, if you want that there, but then it triggers heightened scrutiny, and we have to come and say, okay, how are these individuals not segregated away from the broader community of individuals who aren't IDD or who don't have disabilities. Okay, that's what that is. So we're coming back around to that. So you are in queue for that 5125, and we're figuring out the process behind the scenes. Okay, thank you for that question, Tammy.
So
Did you
do
have
we
anything else on that?
right, do we just hold on then and wait
Yes,
for you
hold
to
on.
come back with us? We don't have to upload anything, we don't need to worry about it, we
No.
just wait? Okay.
Yeah, wait for me. You've done what you can. You've submitted that presumed compliance. And I know you're sitting there with those 3 other IDD providers, and we will come back around when we have that process ready in the portal for you to go through, because we have to develop another type assessment for you all. Because again, we need to figure out, do you own or control that setting? Excuse me, other settings. So we're figuring that all out in the background. Thank you for that question,
All
Tammy,
right.
because that
All right,
is. You are welcome.
So
Anybody else?
it looks like Sheila mentioned that she had to hop off for a minute and had a question about heightened scrutiny. Sheila, can you unmute and clarify what you were needing?
Yes, I was just, I think I got the answer from what LaTanya said later, but for those that were waiting on CMS, we're now waiting until after the corrective action plan is approved.
Yes, so that'll be, when we expect to hear responses on final determinations from CMS.
Okay.
So I don't know if you were on when I was discussing the attestation that would be sent out to the main contact for each setting that has that
Yes.
pending final determination. So that will be your verification.
Okay. So wait for the attestations now.
Right, and we should be rolling that out on the 1st of September.
Okay. And along with Tammy's question, so for IDD 5125, those require an assessment?
Fill out that presumed compliant for that. And then for your IDD, you're going to be in queue for that. Okay.
I think
we're not going to.
I'm sorry. I think it cut out or something right when you were talking.
So for if you're IDD and you also do 5125, you go in, you complete the presumed compliant workflow, and then you're going to be in queue. I'm not going to, me and Caitlin, we're not going to process it. Go in and fill out your presumed compliant assessment, and then you're going to be in queue, because when we did that, and that was for the home and community, that was for our home health agencies and our hospitals that do that home health agency type 5125, that was to screen them out of the full assessment, because that 5125 can also be provided in a facility or a provider owned or controlled setting. If a provider owns or controls that setting, you have to complete the full assessment for that 5125. But if you're just you provide home health agency type services, and that person is truly in a community integrated private setting or living with a family member or somebody, you don't have to take the full assessment. Okay.
Yeah. Okay.
And for you IDD providers, it gets tricky because sometimes you can own the setting, and some of our assisted livings too. Like I said, I ran into a couple of them. They own an apartment building. And I'm like, okay, well, you can't get presumed compliant. And it gets tricky because it's like, well, wait a minute, that's their private apartment that they rent, but it's like, you own that setting. You control that setting. That's why we can't give you that blanket statement. So if you're, I think you may already be in there. If you're already in there, you're in queue and you're waiting for us to figure it out behind the scenes. And then we will follow up with each and every one of you IDD 5125 providers and say, okay, your workflow is ready, but continue business, Sheila, as now you've done what you can by submitting your presumed compliant assessment, and you're good. Okay. Continue as business as usual. It's on us now. And the same thing goes for those heightened scrutiny settings. Okay. Did you have something else?
No, that's it. Thank you.
Okay. Stress. I know a lot of you have that heightened scrutiny has been sticking around for 3-4 years. CMS said, hey guys, until the state level responds and remediates our corrective action plan, they told us they are not going to give a final determination for our heightened scrutiny settings. We will continue to assess and process them and complete them, but we can't give you a final determination because that comes from CMS, and you will continue business as usual, but also look at that site visit from March, that report, because look at your setting, and those are things that they pulled out. So you can already be ahead of the, KDAS to say, oh, we fixed that. You late, KDAS. We're done with our, we've done this. So that's some guidance. They said, hey, continue to work with your settings out there and your providers. Look at that report for all of your heightened scrutiny settings and make sure that they've remediated these concern areas. So that is one way you can look at what's out there on the website. I think Seth shared that link to that heightened scrutiny report that they came out in March and saying, hey, what's going on at our setting? Is this going on at our setting? Hey, let's make sure we remediate that now. So when KDAS comes out to do its ongoing on-site, when you pull up, hey, we've already done that and you're good to go. Okay. But you will just continue business as usual and do those attestations that, as Caitlin said, you will get, because you're going to need something to show to the MCOs and licensing when they do their checks. Okay. And
Thank you.
hopefully that makes sense. Yeah, it gets
Yes.
confusing, even to us up here. Anything else? Anybody on the phone? All right, good questions today. And we'll do one more last call for questions or comments or feedback. I've seen a lot of emails pop up, so I guess everybody's just, I put myself out there.
Can you hear me?
Yes.
Question. Can you give me a phone number in reference to KDADs, in reference to facts, questions, answers, FAQs that we can contact for KDADs in reference to licensing, in reference to everything, so I can have a point of contact, please?
Can you email me that? Because that's not my department. You want to, yeah, email me. My email is in there. Yeah, because that's something I would have to go out to the website too to make sure. Yeah.
Perfect.
But I'll get it. Yeah, get you, or the link to their information on the website. I'll get that email back to you. Yeah. They're with us, but they're in a different department. I see a hand raised, Caitlin.
Yeah, it looks like Brianna has hers raised. If you want to unmute and you can ask your question. I don't know, maybe it was unintentional. I'm not sure. Well, Tanya, I don't see anything else in the chat.
I saw Brianna. Did she say she can't
She
unmute?
did say, yeah, she can't unmute.
What'd
Let
she
me see
say?
if I can, unmute her. Hang on just a second.
And sometimes those mute buttons move around. I've had meetings. You be trying to unmute. You're like, what happened?
It looks like well, on my end, it shows that she's unmuted, but That's so strange. Well, Tanya, I don't know if you want to look, but it shows that she's unmuted on our end.
Yeah, I'm looking for her.
And my only option is to mute her, so.
Brienne, can you see to unmute yourself? Sometimes if you move your cursor around, you're unmute. Yeah, because it says you can unmute yourself. The power is in your hands. Did anybody have anything else? Paul? Well, that's weird. Everybody else? Let me see. Yeah, that is weird.
Hey, Lauren. Hey.
Okay, where did you go? Sorry, you disappeared on me. Brianna, I'm looking for your name. People are dropping off. They're like, they're done. We're out of here. And then
It looks like she put her question in the chat, Latanya. So FEPD
okay.
waiver, we do 5125. Do we do an assessment?
It depends on your setup. Aren't you guys a home health agency? You do a
Yes.
presumed compliant assessment. So go into the portal if you haven't already. You can email me. I can give you that link to the portal. Or Kayla, didn't you put it in there? I think you put it in the chat. The portal.
Yes, the link to the portal is in the chat.
Yes, if you're 5125 and you're doing home health agency type services, please follow that link and you're going to request a new account. And then once your account gets approved for that 5125, once you sign back in after your account approval, is going to automatically, once you select that 5125 service code, is going to automatically route you to the presumed compliant assessment. And then that's where we go in and we look at it. And then we look at that, we compare it to our financial documents, and we say, hey, you got to take the full assessment or not. Okay. And if things change, let us know. Mm-hmm. Okay. Anything else? And make sure you get that in there because, again, the MCOs and licensing will be looking for that to make sure you're presumed compliant or you have your setting certification. Okay. You are welcome. See there? See there, Brianna? You was able to help somebody else out. Like I said, never be scared to ask a question because I'm pretty sure somebody else has it too. Anything else? If not, we'll wrap up so we can all go get some lunch if you haven't got it already. Okay, and then of course, my email is in when it comes to final rule now. Bother those above me like Seth if it doesn't have to do with final rule. But if it's final rule, of course, always email me and I will get you to where you need to be, okay? And I don't hear last call for questions or comments. If not, we'll go ahead and end the meeting. Thank you. You have a wonderful day too. Okay, everybody, we will see you next time. Bye-bye.